Number 1, be good to yourself. As a new nurse, you are going to realize that you're going to be on your feet for a little over 12 hours. So it is important that you hydrate yourself, that you make time to empty your bladder, and that you take your scheduled breaks. If you're no good to yourself, you cannot be good to your patients. Number 2, get to work between 15 and 30 minutes before your shift starts. This will allow you to be able to look up your patient's chart, gather all of your things that you need to be ready for the day, and to be prepared for a report. Tip number 3, find a good nursing brain to be able to take notes. Having that is going to help you to be more effective and efficient when getting report and staying organized throughout the day. Tip number 4, stay organized. It is important that as a new nurse, you are constantly looking at your work list, looking to see if a doctor has put in new orders for one of your patients. There's nothing like doctor putting in an important antibiotic and you missed it because you weren't on top of being organized. Tip number 5, it is important for you to ask tons of questions. Everybody knows that as a new nurse, you're not really sure what you're doing at all times. It's always good for you to ask questions. Never do anything that you are unsure of, because you have human lives in your hands and your license is always on the line. Tip number 6, get a good fanny pack. It is important for you to have something that you can keep your flushes, syringes, alcohol wipes, pens, highlighters, anything that you can be able to keep those things in will be very, very helpful. There's nothing like going into a patient's room and not being prepared because you have to run back and forth to get these supplies. Always keep them on you. Fill up your fanny pack in the beginning of your shift and you will be good. Tip number 7, find your voice. As a new nurse, it's very difficult to be outspoken because you don't feel like you have confidence in your abilities. You're still learning the trade, you're still learning how everything goes, but that doesn't mean that you need to be a doormat or you need to allow anybody to take advantage of you. Remember, you went through your NCLEX, you passed school, and you are a registered nurse. Find your voice. You are your patient's biggest advocate. Number 8, be a team player. You cannot get through a shift without getting help from somebody. It is very difficult. That's why you have your techs, you have charge nurses, and you have other nurses. So I would advise you to help where you can. Be a team player. Step in and say, hey, let me help you do this, because in turn, when you need help, they will be there to help you. Tip number 9, know your resources. Every facility has protocol procedures in the way that they do things. So it's important that you are familiar with your facility's protocol on every procedure. You have your charge nurses, you have other nurses, you have a unit manager, and you have your nurse educators. Take use of all of them. Finally, tip number 10, be patient with yourself. It is very difficult and nerve-wracking as a new grad. And a lot of times you are hit left and right with a lot of information. You are expected to do a lot of things. Every day is not going to be perfect, but you got to remember to be patient with yourself. All right, guys, that's the end of this video. Thank you so much for sticking with me through the end. Please like, comment, and subscribe to this channel. Leave a comment below and let me know what tips worked for you as a new grad. Maybe that'll help somebody else.